Well, welcome everyone. This is Jeanne White, producer of the Wine and Cheese, and today another night of fantastic talking with Sheila and her guest. And I want to welcome Sheila Wilson, Wine and Cheese.
Thank you very much, Jeannie. Hello, my name is Sheila Wilson, host of Wine and Cheese, produced by Passionate World Talk Radio. I am a nurse and president of Stop Healthcare Violence. And just to remind you folks, 70 to 80% of the healthcare workers get assaulted. Now with the pandemic, we wanted to inform the public as to what is really going on with the lack of personal protective equipment. Also, the assaults that are happening to the healthcare personnel. In this episode, I have Amy Smith, who is a registered nurse, Liz Dalton, registered nurse, and Liz, can you introduce yourself?
Sure. My name's Liz Dalton. I've been a nurse for 25 years. Most of my career is in ICU, cardiac ICU, and I'm currently not working because of a episode of workplace violence that occurred to me, and I basically at this point in time will probably not go back into the area of bedside nursing. But I continue to be involved with Stop Healthcare Violence. It's very important for me, and also to advocate for healthcare workers, nurses, PCAs, people that are doctors, people that are at the bedside that are suffering from different things that are happening to them, particularly right now during the pandemic.
Okay. Thank you, Liz. Amy, can you introduce yourself?
Certainly. My name is Amy Smith, and I have been a nurse for about 25 years. I graduated in 96, 24 years, I guess. Spent the first 8 years in long-term care and the last remaining years in emergency room nursing here on the South Shore. I have been on the front lines of this COVID pandemic and have been working our way through.
Thank you, Amy. And I heard the little things. And Beckett, you're on?
I am.
She is our other guest. And could you possibly introduce yourself as well?
My name is Beckett. I'm a nurse for 14 years, been working during this entire pandemic as an ER nurse in downtown Worcester. And just really thankful that you're doing this program.
Thank you. Well, I certainly appreciate you guys coming in. And so in my talk, I said that we were going to inform the public as to what is happening now. What is going on with the personal protective equipment? What is happening? I guess it was Pence that thinks that we should use our masks more often, if I've got that story straight. And crowding on buses that are delivering all the nurses to work. So which one of you would like to get started? I can pick one of you.
I can just give a little information. I had seen the post from PBS with the Associated Press stating that Vice President Pence is they're going to be giving an executive order for healthcare workers to reuse PPE. This has just been published on the 8th, July 8th. So now we're going to go right back to square one. And then any other information that I thought was important to know about is the Mass Nurse Association is going to do a webinar. It's going to be a full day of from the Mass Nurse Association and the Health Watch USA, which is a nonprofit, and it's about the effects of frontline workers from across the globe, which is going to be on July 15th, and people can go to massnurse.org and find out more information about that because they need to talk about what they've been through and what we're going to be facing again. And I think the other nurses can talk about what they're actually experiencing.
That's great, Liz. That I read that about M&A too. I think that's going to be a great. Did they call it a seminar or
a webinar?
A webinar.
Yeah, and it will be nurses will get CEUs from that as well if they attend.
That's awesome, and it will be all on like a Zoom.
I believe it's going to be a webinar, so it'll be like Zoom, but I don't know if it'll be exactly Zoom. You know, it'll be definitely an internet connected seminar.
Awesome. Amy, do you want to be the next?
Sure. I know. So today, the facility that I work at, we get together once a week. It'll be going to every other week as a task force, a reopening task force. And one of the primary reasons for that meeting that we have is to discuss the PPE and the status that we're in. Currently, right now, in our area, the positive patients are at a manageable level for what we have on hand for PPE, given that we're reusing it. So currently the facility I work at, the guidelines are 1 N95 mask for 3 shifts. And then you get
Wait a minute, 1 N95 for 3 shifts?
Correct.
So that could be...
Before was one for 2 weeks, and they were sterilizing it. They're no longer sterilizing masks. We have enough on hand that they don't need to do that anymore. The stockpile has come back to us because our volume of patients has gone down to a manageable amount.
That's good news, but I still don't understand why you need the N95 for 3 shifts. Some people work 12 hours, some do 8 hours. That's a long time with the same mask.
It is. So again, manufacturers' guidelines say that mask is a single use. I walk into the room, I put the mask on my face, I do what I need to do in that room, I leave, and I should be throwing that mask in the trash, knowing full well that probably in the next couple of hours, if not sooner, I will need to return to that room and would potentially use another mask. And those were the standards in the first 24 years of my nursing career, right, that I lived under for PPE and these specialized masks.
Absolutely.
The max from manufacturer says that you can use it for 4 hours. So if I was in the room and remaining there, then I wear that effectively for about 4 hours. In the height of this pandemic, with the decrease in supplies, we were being asked to use those masks almost infinitum until it fell apart. And then, or, wear it for 3 to 5 shifts, have it sterilized to then wear it again for another 3 to 5 shifts. But given our supply, our hospital attests to want to return to manufacturer's guidelines. But they're not moving past the same mask for 3 shifts.
Now, what is the reason for that? I mean, is there not enough masks still?
They're telling us that their supply has come up and that they have enough supplies on hand if we were to surge again currently, but keeping with our standard of masks, so that mask being 1 for the 3 shifts, not going back to manufacturer standards. We have 160 days worth of PPE on hand for our staff. And that's how they break it down.
I just saw an ad. Excuse me, Amy. I just saw an ad on the website saying that you can buy N95. So why aren't the hospitals buying more? Do you get that information? Anybody ever say anything why?
They were awaiting a really large shipment of the NIOSH N95s, which were the 3M N95, which were the standard ones that we used here on the South Shore anyway. They were supposed to get more of those in the beginning of July, and now they're being told the beginning of August. So the hard part for us as staff is we want, you want the hospital to be diligent in obtaining these supplies. I have to assume that they're doing their due part, and now the manufacturers are not sending them. So we've got the orders in, the hospital saying, here's the money, here's the account, and now the supplies are saying, once again, we don't have the supplies to send you for that shipment, is what we're being told.
Wow. Yeah,
wow.
I think that what you're looking at is they're looking for the highest bidder.
Well, and so hospitals, again, typically operate under what's considered lean. So, one of my questions at the meeting, and I didn't really get a straight answer, although they're going to get back to me, is that if they're operating under lean, are these under their lean numbers that they're looking to stockpile? Because that wasn't adequate for the initial surge when we weren't using N95 masks, right? And we had our full complement of what the hospital said we're supposed to have on hand under their lean guideline, we know is not enough.
Right.
Beckett, do you have some information from the Weston?
Their lean left us exposed at the beginning of this and has continued to leave us exposed during it. It's just not acceptable answers on their part. I know that right now we're decent. We're still doing an N95 a shift. We're not reusing them, but it is an N95 for a 12-hour shift. And as Amy already said, it's supposed to be a one and done. You go in, it's contaminated. You come out, it's contaminated. You toss it. You don't keep it on the entire shift and walk room from room from room with it, which is what we're expected to do now. Or take it off, put it in the Tupperware container, switch it out for your surgical mask to go into a non-PUI room. So the level of protection still isn't what it should be, and I'm still anticipating a second surge. I really am. I don't think this is going away anytime soon. I don't think that the hospitals are preparing for a second surge like they should be, and they now know they can't plead that they're blind to what was needed or what is going to be needed, because we've already done it once. So they know what we have to have on hand and what they need to supply and how to best protect not only their staff but also their patients.
That I don't understand, because with the N95s, is there any chance that a person that doesn't have the virus is a roommate of somebody that has the virus? So that when you're going into that room, in your head, you know that there's one person with the virus, but that other person, I don't know the bed situation that you folks are working with, if you're on a COVID floor.
We're not cohort. We're testing all patients from the emergency room. So any admission that gets admitted, and we've caught some asymptomatic patients that way, actually. We've had more asymptomatic positive patients as of late than we've really had your sick ICU needing intubation type patients.
Just to let me get this straight, Becca, you're in the ER, and you're treating everybody with the same mask on.
Well, we will have our N95. So if I have an assignment of 4 patients, which is likely, or 5 patients at this point, because they've bumped us back up again, we could have a PUI room, it's a single room, but then the patient next to them could be a non-PUI. It's not like there's just one area that's PUI anymore.
Explain again, PI.
A PUI is a person under investigation or somebody that they suspect may have COVID.
Yeah.
So they have signs and symptoms of possibly having it. So they're going to get tested, and we won't know, depending upon if they're given a rapid test or a few days later, whether or not they have it. And even then, the tests aren't exactly accurate. We've had people get tested 3 times, come back negative, and then antibody tests show that they were positive.
Right. I just went through that all last weekend, where my daughter was informed that she had a coworker that she might have been beside or talking to or whatever, but she could have gotten infected. She had to go get a test. She went and she got the test. They test them every 3 weeks, and it was negative. My son, now they live in 2 different states. One lives in New Hampshire, one lives in Vermont. My son was talking to a gentleman that works in the same place that he works, but then his wife came along and put her head inside the window of the truck that they were talking into. And he got a phone call saying that he might have been subjected to the virus. So he goes and gets tested. Of course, it takes 2 days, almost 3 days for him. And she comes back. They said that she had a positive test. It comes back, and it was a negative positive. So that, I mean, I don't, it was like 72 hours of this horrendous worry about what's happening. And my husband and I are older, and the kids don't want to be around us because they don't want to give us the virus. And it's, you know, and it was terrible. But I'm just wondering how. Thank you for explaining everything, Beckett. Go ahead. I interrupted you.
Not at all. So when we go into a room that has a PUI, obviously we're gowning up, we're putting the gloves on, we're putting the face shield, and we're putting on the N95. When we're coming out, you take all of that off. That gown is for that one room now, which is different than what it was before, which we had one gown for the entire shift.
Yeah, that's awesome.
Yeah, but now we have a gown per each PUI patient, so we keep our gown outside their room. And if I have to go into another patient's room that's possibly a non-PUI, then I'm taking off that N95 and I'm putting on a surgical mask. So
at least your face is getting a little.
That N95 keeps coming on and off, on and off, on and off out of a Tupperware container.
And so you cover the Tupperware container?
Yep. Yeah,
so
they gave us those at the beginning for us to be able to store them for 3 days.
I don't know. I wonder. Now, are there any infectious nurses around there, infectious disease nurses?
I don't know.
We do have an infectious disease nurse. We have. She's actually very smart, but I think unfortunately corporate overrules them and their education.
Yep.
Amy?
We have infectious control, but I think it's the ID doc that does the the fancy antibiotics and all that. I'm not sure I agree with it. I think it's a corporate position with a corporate background. So they're not given the carte blanche to say, even if they believe that the equipment is not being used adequately.
I worked with a couple of ID nurses, and they were fantastic. And they were very involved in everything that was going on. And I've often wondered what the infectious disease nurses would be, how they feel with knowing that this is going on, or even if they're working. It's just terrible. You guys have been going through this. It's almost 5 months, isn't it?
Yep.
It has been. I think I moved out of my house the second week of March, and I came home on Father's Day. And it almost feels like it was a blink until I looked at the calendar and realized really weeks went by.
It did. It's terrible. And Becca, are you still at the dorm?
I actually just moved back 2 days ago. So
that's
I am
wonderful.
in the dorms. But it's definitely weird, and tonight is my first shift back, and I'm a little paranoid.
Yeah.
Right.
So.
Well, you're concerned with one of your family members, and
my son has a reactive airway that's pretty significant and has reacted very poorly to just getting baseline viruses in the past, never mind COVID.
Right. I have another question. You know, it's. I talked to a lot of nurses, and one of them was she was on the deep end one day. She went into work, and there's a lot of patients that have the virus on her floor, and somebody put a fan up, and the fan is blowing around. Well, what do you girls think about that? She was concerned that if there was any viruses in the air, now they're all over the place.
Yeah, you're not allowed to have a fan. You're not allowed to have a fan.
They just air. We couldn't do nebulizers in the beginning,
right.
And they were terrified of BiPAP and intubation, and we're putting these plastic trays and ponchos over people's faces because of the possible aerosolization just in that immediate vicinity. Never mind to then blow it all over the unit. That's just
that's not,
very poor practice and insanity on whoever did it.
Well, she never found out who did it. And whether maintenance come up, somebody had complained that they were hot, you know, one of the staff, and somebody went and got a fan, and the next thing she knows, she walks out onto the main floor and in the hallway, and there's the fan. And she just erupted. It was like...
Yeah, that's a facility that's really lax to their ways. I mean, we're seeing it a little bit. You know, occasionally the ER docs will be sitting without a surgical mask on, and you have to kind of look at them and remind them. Or they're going to peek in quick. You can't drop your guard because we don't know.
No, you can't.
This virus is still very much out there. It's still marching across our country. And now that we've opened up the possibility of air travel to these other areas. So I think we've done a good job here in Massachusetts. At least it feels that way from my perspective on the nursing side.
Mm-hmm.
And I'm happy to watch. I myself, I'm not back out there, right? I'm still not going to target it free will because I am exposed, and I don't want to bring it out there. But it's nice to see other people. But the fear is then the travel happens, they're bringing it back.
Well, this is now Beckett. You mentioned you thought that we would have a second surge.
I definitely think there will be. Between opening it up and we're looking at, as she said, travel, and people are. We just had one of our management leaders go down to Florida, which is a hot spot. I mean, it's just
irresponsible.
Yes, absolutely. Yeah. So they're gonna. They want us to tell them if we're traveling anywhere. But then there's no self-isolation unless you're symptomatic. There's no, quarantine unless you're symptomatic. And even then it's, okay, so your symptoms are done. You can come back to work. And we don't even actually have all of our furloughed nurses back on the job yet either.
Oh, really?
So, no. Amy, are all of your furloughed back?
I believe ours are all back except for there were like two that had respiratory issues with the documentation saying they couldn't be anywhere in the vicinity because we can't guarantee that for them. They are still out on their medical, but they're not, I guess it's more FMLA, not furlough.
Yeah.
At this point.
How many nurses have been ill in each of your hospitals? Do you know?
I honestly have no idea. They've tried to keep it quiet. Like they won't even. We find out after somebody's returned after being gone for a week or two that they had tested positive. They didn't even notify us.
See, I don't have my numbers here in front of me, but for our hospital, and I think, Beckett, you work at a much bigger facility. Brockton's pretty small.
Yeah.
We've been kept in the loop.
Can you repeat that, Amy?
I think Beckett works in a much bigger facility.
Yeah.
Yes.
But I feel like in the hospital that I work at, being the size of it is a small community hospital, we've been kept a little bit more in the loop as far as staff that have been positive and that kind of thing. I believe we still have, I don't have the numbers here in front of me, although it was reviewed at today's meeting. They say how many staff are positive who's still out ill, those kinds of things.
Wow. Did the numbers surprise you, though?
Initially, the numbers were low. So when they first started reporting and we started meeting with our management team once a week, my co-chair and I met with management once a week. Their numbers seemed low from what we were hearing from nurses. And so we called them on the carpet. You know, they said they had like 4 nurses. I then went on our Facebook page that we have with our union nurses and asked. And then I turned around and said to management, well, that's a lie because I have these, you know, these patients, these nurses have come forward, so I know that number's not accurate. You know, help us help you. We're trying to help you keep these nurses safe, and we have the platform to do it with our closed Facebook page. And so they were a little more forthcoming after that.
Well, that was good. Wow. So things sound like they're coming up, but certainly not fast enough. And it kind of scares me to think that we might get another surge, which I could certainly imagine happening with now that Governor Baker said we could open up and the gyms are open, the movies are open, you can get your nails and feet done and all of that type stuff. However, they're keeping it as you wait outside and then you get called in. Well, I don't know about the movies. Somebody said that they have petitions all over the place. So I haven't been into a movie theater, so I don't know what that looks like, and I haven't been to a gym. But the people that went to the gyms before, I have a couple of friends that go, they said that people don't clean off their machines, so why would we expect them to clean off their machines now? You know, is that a good place to be going?
The scary part is, especially in the healthcare world, if those who are in charge of the house, if you will, aren't forthcoming with what their needs are across the board, it just sends a much more nerve-wracking message. If they had
Go ahead.
It would just be so much better if they were standing beside us and able to go forth with these are our needs for our staff so that our staff can take care of our patients.
Right. And so what is the blockade there? Why don't they stop and talk?
Well, I don't know why they don't. I think it's just the hierarchy of the way management works. Unfortunately, in healthcare, and I've said this before, in hospitals, most are doctor-driven or management-run, except you're not admitted for doctor care. You're admitted because you need some form of nursing care, dressings to be done, medications to be administered. And yes, your doctor orders all of those things for you. I don't do that independently. I wouldn't know what to order necessarily in all cases. But you need me to administer those to you. So the hospital should be looking at, you know, your nursing staff, your cleaning staff, first and foremost, and then how can they, so that we can treat the patient. Just a different approach.
Right. What about yours, Beckett? You have anything to say on that?
Could you just give me the question again? I'm sorry. This is a little different now because I have a child who keeps interrupting.
Oh, that's okay.
Oh, he wants his mother.
That's right. You're multitasking as nurses are so good at.
Unfortunately.
So,
Amy, can you let her know what you were saying?
I was just saying how I wish that the hospitals came to us as the frontline people, as the reason why these patients are coming to the hospital, for our opinions as far as supplies, as far as how to go forward, as far as plans, especially where we're the ones putting forth the plan.
I think many years ago that's the way it was. That's why things could get done. You know, when the hospital turned into this business model, which is, you have healthcare, like where is the empathy? Where is the humanity of the upper echelon and the management? What has happened to them that they can no longer give that to the people that are putting themselves in danger and also giving the best care to their patients and trying to keep them well and keep themselves well. And they're on top of all of this looking down, which I'm going to be very controversial here, from their ivory tower, looking down, but never really experiencing it. Okay, they're looking at numbers, they're looking at budgets, and they are not, I don't think they have used their full intellect to even, to do something like that, to have the nurses give them ideas for a better plan, a better way, even more efficient. So I find, I know I have a big mouth right now because it just makes me so upset that this isn't happening, because things would be so much better.
I don't think it's being a big mouth. I think it's being honest and, unfortunately, casting a light on what the hospitals as a corporation are doing and not hospitals with the souls of the nurses.
Right.
It's not being a big mouth. It's actually what we should be doing, which is advocating for our patients and for ourselves and for our coworkers. And we've been doing that. I think, the M&A has been very effective with, at least at my facility, in helping with that.
Absolutely.
And I'm very thankful that we're union, because I saw what happened at the non-union hospitals, and I can't even imagine being a nurse there.
Nope.
And what they would have gone through. So as to, the public's looking to us and want us to give our information, but at the same time, the hospitals, they're not doing what they should be doing. They haven't been doing what they should be doing as a corporation. They are just looking at the numbers. They're looking at, they were ready to step out of right into step 2, into phase 2, without even having nurses back in those departments. Our departments, our ORs, our PACUs, they've all been struggling because these nurses are still furloughed, and they're being told they'll still be furloughed until August, a month away.
Wow.
But they're now doing surgeries, elective surgeries. We're going to do those because, you know what, they want to make the money. And they bankrolled during this whole thing. That Tenet bankrolled this entire pandemic. They put money aside. They knew what they had. They applied for grants. They did everything they could to grab at the dollar signs without putting the patients first.
That's
and
right.
Now we still have a unit that's a full COVID unit, and those nurses are burning out. They're burning out, and they're increasing their numbers again, and without any, care as to the welfare of their staff or of the patients. Because if the nurse is burnt out at the bedside, that doesn't lead for the best patient care.
No, it doesn't. No, it doesn't.
And it's
the worst thing.
It's not on the nurse at that point. It's on the facility.
It's on the facility for sure. And I believe every other single huge corporation is doing the same thing. I can tell you right now that I said this on the last podcast, but when I look what's happening in the news with, like, the Brigham and Women's Hospital, okay, the nurses are everyone pays for their parking, okay, and they're shuttled to all different places in the city to park. They're sending these shuttle buses out, and they're shoulder to shoulder, no standing room only. They're all together. They're piled into these buses to be brought, and the M&A is fighting it right now because this is not safe. This is not a safe scenario for nurses after working, 8 to 12 hours or even maybe a double, and getting on those buses, and they're cramped together in these seats. And they've been the hospital keeps saying they're going to do something about it for at least 6 weeks, at least, and they've done nothing. But they can spend $100 million on a new branding with partners, with Mass General and Brigham Women's Hospital. $100 million just for a rebranding. So that really.
What does that say about the nurses?
It says that they don't care. They could care less. I mean, that's really, like, as far as I'm concerned, this is like, I can't even believe this is happening in this country, and I'm sure when they do the thing with the M&A, of the global webinar with different people working with the pandemic all over the world, I'm curious to see how are the other countries treating their healthcare providers, compared to what we're doing here. Because I think it's happening in the way that it's happening. I think it's even a little bit better in Massachusetts, but I think even other states are suffering even more.
Yeah, I think they are too.
And how could you, in what we're talking about, how can you even, think about that, that it could be worse? And with, these really hot states like Arizona, Florida, Texas, I mean, it's not getting any better. It's getting worse.
It is. It certainly is. Becca, do you have any comments? No?
I cannot. I can't get over the fact that they're putting everybody in a bucket. We're lucky that our parking garage is right there. So literally we drive in and we walk through, and we have one entrance that we go in through and one entrance that we leave through, and we have to have our badges, have our hand sanitizer, get our mask, get our temperature taken all in one fell swoop. So to be put on a bus shoulder to shoulder.
Yep.
And
it's
that still, if any of those nurses get COVID, it's going to be that they got it community acquired because they weren't in the hospital.
Absolutely.
They'll have to prove
it. The hospital is actually stating that if anyone gets sick, it's not because of the hospital.
Okay. Yeah. They've
believe that?
They've taken that stance for a while, and it's absolutely laughable.
Yeah, it is. It's like horrendous. It's like, I don't know.
Just because you say not me doesn't make it not you.
Right.
You're right. You're right. I think what happened to the hospitals, and instead of taking, they became a business, and the patient is no longer a patient. No, and he basically is a consumer. That's all. And I think from that day on, they started more. They gave and gave and gave to what they thought that this person would want. And it's changed the whole thing. Because as Liz said many years ago, it wasn't like that. I've been in the field for over 40 years. And there used to be a time that your CEO would be walking down the hallway saying hello and using your name to every single one of the employees.
Absolutely.
Now, you're lucky you can even know who your CEO is. They change like whatever. So, and you're not involved with them.
Well, it used to be the director of nurses was the voice of the nursing. Now they're being used as the guise of nursing for the management side. It's not the same.
Right. Our nursing director used to be on the first floor, and her door was always open.
Absolutely.
When I left, the nursing director was on the third floor behind 3 closed doors.
My nursing director doesn't have a placard on her door. You wouldn't know that was her office. You would walk by it all day long. It took me 30 minutes to find her when I first started. I had to ask her. I'm like, you need to show me which door because I don't know. And it's a door and a door, like an office and an office. And her name is not on the door.
Well, I can tell you at the Brigham and Women's Hospital, where a lot of my colleagues are right now, the nursing CEO, the elevator doesn't even stop at that floor.
Wow.
Okay?
What do you mean it doesn't? They have to have a key to get it to stop there?
You can't get up there. You have to make an appointment, and she comes to you. You can't even get off the floor where the executive offices are.
It's a level of paranoia.
I feel like we're in the Wizard of Oz. And it's the man behind the curtain.
It's the Twilight Zone. It's the Twilight Zone. It's just not, I don't know, it's just not acceptable. But like I said before, and this is in no way to want to make a nurse's job more difficult, but I feel personally, if I have to go in for surgery or whatever procedure I'm going to have, I'm going to ask that my nurse has a new mask if she has to deal with me, if I have any kind of symptoms, or whatever. I mean, look at how many people are being tested that have no symptoms.
Right.
So
Off
that subject a little bit, what does that even mean? Does it mean they got a lower viral load than somebody else that got more sick, or was it their immune system, or what was that? Because we can have people that we're even just dealing with in this isolated world be positive.
Yep.
You know, and
they still can't answer that question. Is the bigger takeaway for that? They still don't know, and yet they still don't want to universally protect.
Yeah.
Well, I don't know. It brings me back to almost 40 years ago when HIV was rampant, and how we never even used gloves. And now all of a sudden, I mean, if we don't use gloves now, that's really, you know, you start to think to yourself, why isn't that nurse wearing a glove? Why isn't she wearing a mask? Why isn't she using the booties that are supposedly there and the gowns?
Right.
Oh, you don't have them now. You know, they're kind of scarce. But anybody have anything else to talk about? Any more updates that we should let the public know?
I think just from a perspective of downtown, I know that it's getting more violent again, too.
Yeah.
So not only are we dealing with the pandemic still, because it's not gone and it's not going away anytime soon, but now that people are getting out and they've been, you know, in their self-isolation for months, the violence has increased on the street. Now the violence is increasing back in the hospitals.
Mm-hmm.
Yeah.
So I don't know what you guys are seeing, but I know that we've had an increase of assaults and issues and outbursts, and our regular patients that come in with their behavioral issues are now back. So we're ramping up again and still dealing with the PUIs and the COVID positives.
We're seeing
well,
the same
we really need to get into that. I'm going to look into that a little bit more. I definitely, if you know, as a nurse, you see it on the street. It's coming into the hospital. It's going to come into the hospital. People are at a very high level of frustration, and if they have any alteration in coping with their anxiety and their mental health anyway, they are going to be triggered to be more violent. And that's unacceptable in the hospital, and that's another thing. We can't work under those conditions. You cannot feel safe. If you don't feel safe, you can't even perform your duties.
No, you can't. It's a very, very, unless you've been assaulted, you don't understand what happens.
Oh, no, I look behind my back all the time. I'm actually live like an isolated person. So being more isolated was, in some ways, it made me even feel safer from the violence. Like it's very hard for me to even go into a grocery store. And for people to have masks on too, that it's like, oh my, and I want them to have masks on. I want to have a mask on. But I seriously will not stay in that store more than 5 minutes. I just want to get a few things and get out ASAP.
Yep.
Because of what I've experienced, of the unpredictable, of the something that you never thought would happen. It can happen anywhere, but like I said before, it's out on the streets, it's coming in the hospital.
Yeah, well, it's in the buses, it's on the trains, it's in the supermarket. You don't know when you're going to get assaulted. And if you wear scrubs, clean, dirty, or whatever, nurses and all healthcare workers have been assaulted while they're just running in for a gallon of milk. It's getting worse.
Well, and the PPE makes it so distracting.
Yes. I can hardly breathe in them. I don't know how you girls do. I need to congratulate you on that. I'm kind of like...
It's a lot of moments
when you're taking care of assaulted patients.
I'm sorry, Beckett?
I said there's a lot of moments of, especially in the beginning, there were a lot of moments of, yes, you can breathe, nope, stop panicking, it's so good, and talking yourself off of it.
Yeah. I could see that.
I haven't got to that level yet. I put the mask on going into the supermarket, and it's like, oh, my God, I have to find a bathroom so I can take it off. Now, that's not even a good choice, because who knows who's been in that bathroom, who's been coughing and everything. But it's like, whew. Okay.
12-hour shift of either talking myself off the ledge or exposing myself to somebody. I'm going to have to learn how to talk myself off the ledge.
Yeah. Well, when you learn that phase, let me know so that I can at least get to the grocery store and stay there more than 5 minutes. Anybody else have anything else they want to say?
I just wanted to say one more time, we talked about it before, but the M&A with Boston University is doing the study with nurses. You can find it on the massnurse.org website. It's like a study of nurses and what they're going through and what they have previously gone through with the pandemic, with mental health, anxiety, many different psychological and physical problems. And it's to do a large study. So if there are any nurses out there, that I think it would be great if your voice is heard through that study to see what overall has been happening when they come to their final results of that research study.
That would be good. That's the one that is free, correct?
Right.
Yeah, that sounded good. Yeah. Anybody else? Should we finish our program for tonight?
Yeah, and thanks for the people that were listening, and just you're always in my thoughts, in my prayers for all the people on the front lines, and also for the future. It's just constantly in my mind of what everyone's going through. That's my thought for today.
Then I'm with your thoughts. You guys okay?
Yeah, thanks for always having us. We appreciate it.
Oh, thank you. I really appreciate you informing the public and letting them know what truly is happening. So I will say good night, and I thank you, Amy and Beckett and Liz, for coming on again and taking such great care of the patients, finding out information to share with the public. And I want to thank the audience for listening to this show. But if anybody has missed anything from this show, you can hear the show again on Spotify. I'm signing off as Sheila Wilson on Passionate World Talk Radio. Thank you for listening.
Well, thank you very much, Sheila, and your rest of your guests. It was really an interesting and informative interview. Again, if you want to hear this show over again, you can also hear it on Spotify. And I want to sign off saying this is Jeanne White. I'm the producer of Wine and Cheese, produced from Passionate World Talk Radio. Thank you, everyone, for listening, and please be safe out there. Bye now.